cervical spine fusion procedure is one that involves removal of pressure off the spinal cord or nerves, and generally involves placement of instrumentation including screws and rods or plates in order to stabilize the spine and promote bony healing across that region. Fusions can be performed anteriorly in the spine, which would involve placement of a spacer as well as a plate to stabilize the spine, or can be performed in the back of the neck through an incision that involves placement of screws and rods to stabilize the spine as well. Patients that undergo the surgery usually have symptoms related to spinal cord or nerve root compression or abnormal movement called instability, which then requires placement of instrumentation and fusion to stabilize the spine and decompress it at the same time. The risks of anterior cervical spine procedures generally includes difficulty with swallowing or dysphagia after surgery, which generally improves with time, as well as some folks will have some issues with their voice function, including hoarseness, that generally improve with time as well. The benefits of cervical fusion operations include alleviating pressure off the spinal cord and nerve roots to really help patients with the pain and weakness that they may be developing. We generally see really good results early on after this type of surgery. Preparation for cervical fusions in general would involve a cessation of nicotine use for at least 1 to 2 months prior to surgery in order to optimize their bone healing fusion rates. Following cervical spine fusions, patients often have good relief of a lot of their symptoms early on after surgery. Recovery generally can be up to 2 to 3 months prior to return to more physical activity. Patients that undergo cervical spine fusions can often detect some improvement in their pain or weakness early on after surgery, along with the expected post-surgical pain. Overall, cervical spine fusions have the highest outcome improvements after spinal surgery. We generally have performed a number of anterior cervical spine fusions on an outpatient basis, and we've had tremendous success over the course of years with performing these type procedures at our outpatient surgery setting. The best candidates for this type of procedure are patients that have a combination of nerve compression, spinal cord compression, and neck pain, who also might have some amount of instability that would benefit from instrumentation and fusion. Patients that have cervical spine issues who go on to need to have fusion can range in age from early adulthood to later years in life, and we generally would look at the individual patient and determine what best approach or surgery would benefit them. Overall, we see better outcomes with fewer complications with patients that have a BMI of less than 40. It's important to see a specialist for this type of surgery to be able to evaluate the individual patient and to be able to determine what best approach would that patient benefit from to treat their problems. Anterior cervical spine fusions are often performed with a small incision about an inch or so off to the side, where we are able to dissect through and be able to clean out the disc and be able to put the instrumentation in. The skin's oftentimes closed with Dermabond or skin glue without sutures or staples to remove. The incision and the healing is attractive to patients because there's generally not any wound care involved. It allows patients to go home, to be able to shower, to wear clothes as they normally would without worrying about dressings or sutures or staples that might affect their clothing. Anterior cervical spine fusions, single and 2-level and healthier patients, are most often performed at our outpatient surgery center. Patients that might have more medical problems or require more extensive surgery will be performed on an inpatient basis at an inpatient facility. The benefits of performing spinal fusion procedures at an ASC or an outpatient surgery center allow for convenience for patients and their families to be able to come into a facility, to be able to have care rendered by a team of healthcare employees that are geared towards treating that specific problem on a regular basis. And so there's a lot more familiarity and standardization with the type of procedures that we regularly perform on an outpatient basis.